Welcome to the Pathways to Wellbeing documentation course, Pathways to Wellbeing portion of the Behavioral Health Assessment. This course is one in a series of learning opportunities designed to help familiarize you with pathways to well-being and continuum of care reform concepts, practice, and documentation. Pathways to Well-Being supports youth by bringing together the child or youth and their family, behavioral health services, child welfare services, and other critical partners to support the safety, permanency, and well-being of youth involved with the child welfare system. As a behavioral health service provider in the County of San Diego, your responsibilities under Pathways to Well-Being include creating and maintaining complete and accurate documentation of service activities. This course will describe the Pathways to Wellbeing portion of the Behavioral Health Assessment and how and when to complete this portion of the assessment to record pathways to well-being eligibility for youth involved in the child welfare system. This short course is designed to familiarize you with the Pathways to Wellbeing portion of the Behavioral Health Assessment, or BHA. You will learn what the BHA and the Pathways to Wellbeing portion of the assessment are, when to complete this portion of the assessment, how to access the BHA, specific steps for completing the Pathways to Wellbeing portion of the assessment, and some helpful tips to support you along the way. The BHA is a comprehensive psychosocial assessment that documents presenting problems, relevant behavioral health history, risk factors, pertinent family information, and a clinical formulation where a formal diagnosis is stated and an appropriate plan for treatment is outlined. The Pathways to Wellbeing information section on the BHA is used to record pathways to well-being eligibility for youth involved in the child welfare services system. Providers complete the Pathways to Wellbeing information section on the BHA for all youth that have an open child welfare services or CWS case. This includes youth who have either an open court-involved case or youth receiving voluntary services. This does not include cases that are in referral status. Providers will continue to monitor cases, including those in referral status, to ascertain whether the case becomes an open CWS case or voluntary services case. When or if it becomes known that the case status changes to an open or voluntary services case, the Pathways to Wellbeing section of the BHA will be updated to include the CWS information. The BHA is completed in Cerner Community Behavioral Health, or CCBH. To access the BHA in CCBH, log on to CCBH, select your client, click the top portion of the New Assessment tab, select Assessment Type, click BHA Children, enter the date and save. The first page of the BHA contains Pathways to Wellbeing questions, which are used in conjunction with completion of the Eligibility for Pathways to Wellbeing and Enhanced Services form. Please refer to the Eligibility for Pathways to Wellbeing and Enhanced Services form, Documentation Microlearning, for more information. The provider can obtain the name and contact information of the CWS Protective Services Worker, or PSW, by calling 858-514-6995. This number is located at the top of the first page of the BHA. When requesting the PSW contact information, the provider only needs to provide the child or youth's name and date of birth. The provider can also request the name and contact information of the PSW Supervisor. The supervisor's information can be useful if the provider is having any barriers communicating with the PSW. The provider collaborates with the assigned PSW to complete questions 1 through 4 of the BHA. At the top of the BHA, select whether the youth is involved with CWS. If yes, check the box marked yes and enter the Child Welfare Services PSW's name. If the youth is not involved with CWS, check the box marked no, and the remaining Pathways to Wellbeing section of the BHA will be grayed out. This section identifies 6 options to identify the legal status for the CWS client. The information required to complete this section will be obtained through collaboration with the assigned PSW. Check the box that describes the current legal status of the client's case. VS Voluntary Services. CWS has not filed a petition due to intent to divert from dependency by providing services. Court does not have jurisdiction. Pre-adjudication. CWS has filed a petition in court. Child may be with parents or may have been removed, and dependency has not yet been established. FM Family Maintenance. Court has jurisdiction. Dependent placed at home with parent. FR Family Reunification. Court has jurisdiction, dependent and out-of-home placement. EFC Extended Foster Care. Program that is available to youth 18 to 21 years old who were under foster care placement order at age 18. PP Permanent Plan. Court has jurisdiction. Specify APPLA, another planned permanent living arrangement. Legal guardianship is pending once finalized dependency ends. Adoption is pending once finalized dependency ends. CWS Child Living Arrangement identifies where the client currently resides. The information required to complete this section will be obtained through collaboration with the assigned PSW. Check the box that describes the client's current living situation. Parents, relative, non-relative extended family member or NEFRM, licensed foster home, San Pasquale Academy, supervised independent living placement or SILP, foster family agency home or FFA, licensed group home or LGH, residential treatment center or RTC, LGH with a mental health contract, short-term residential therapeutic program or STRTP. If the client is residing in an FFA or residential setting as listed below, enter the name of the placement. FFA name, LGH name, RTC name, STRTP name. There may be multiple petition true finding selections. These are based on Welfare and Institution Code Section 300 as adjudicated by juvenile court. The information required to complete this section will be obtained through collaboration with the assigned PSW. Check the box or boxes below as indicated through CWS collaboration. Physical abuse, neglect, general or severe, emotional abuse, sexual abuse, severe physical abuse of child under the age of 5, death of another child caused by parent, no parent or guardian, freed for adoption and adoption petition not granted, cruelty, child or client at risk due to abuse of sibling. This section addresses KDA class or KDA subclass status, which is selected based on determination obtained from completion of the Eligibility for Pathways to Wellbeing and Enhanced Services form. Member of class, member of subclass, not member of class or subclass. Eligibility status pending. When completing the Pathways to Wellbeing section of the BHA, questions 1, 2, and 3, the provider will need to collaborate with the assigned PSW to gather the necessary information required for these fields. For completing question 4 of the Pathways to Wellbeing section of the BHA regarding KDA class or subclass status, if the youth does not meet the Eligible for Enhanced Services subclass criteria as outlined on the Eligibility for Pathways to Wellbeing and Enhanced Services form, select member of class. If the youth meets the Eligible for Enhanced Services subclass criteria as outlined on the Eligibility for Pathways to Wellbeing and Enhanced Services form, select member of subclass. If there is not enough information available to make a subclass or class designation, select Eligibility Status Pending and update the section when the information is obtained. In order to determine if a youth is designated as KDA class or subclass, providers will reference information obtained in conjunction with completing the Eligibility for Pathways to Wellbeing and Enhanced Services form, including Does the child or youth have an open CWS case? Does the child or youth meet medical necessity criteria? Does the child or youth have full scope Medi-Cal? Has the child or youth gone through 2 or more placement changes within the last 24 months due to behavioral health needs? Is the child or youth currently being considered for, receiving, or recently discharged from any of the services listed on the form, generally within the last 90 days? For more information on how to complete the Eligibility for Pathways to Wellbeing and Enhanced Services form, please refer to the Eligibility for Pathways to Wellbeing and Enhanced Services form, Documentation Microlearning. If the provider has difficulty obtaining the necessary information from the PSW for completion of the Pathways to Wellbeing section of the BHA, the provider can reach out to the PSW Supervisor for assistance. If the provider has difficulty reaching both the PSW and the PSW Supervisor, the provider can reach out to the BHS Pathways to Wellbeing team for assistance. The Pathways to Wellbeing team roster can be found on the Pathways to Wellbeing and Continuum of Care Reform page on the RISE website under Contact Us. The site URL is displayed here on the screen. Providers must complete the Pathways to Wellbeing information section of the BHA for all youth that have an open CWS case, including voluntary cases. In this course, you learned what the Pathways to Wellbeing portion of the BHA is, when you need to complete this portion of the BHA, and how to access the BHA and complete the Pathways to Wellbeing portion. You also learned some helpful tips to determine KDA subclass or class eligibility in conjunction with completion of the Eligibility for Pathways to Wellbeing and Enhanced Services form, and what to do if you need assistance getting in contact with the child or youth's CWS PSW. We encourage you to review the other courses in this learning series. Thank you for attending this course.